Hello, thanks to ISNTD for having us here and for making the time to hear my presentation. So, Break Dengue is an initiative that's part of a small social enterprise based out of Brussels. And to explain a little about who we are and what our approach is, especially related to partnerships, I'll start with a problem that we're trying to tackle. And that's related to the issue of surveillance, something that's been brought up throughout the day. So there's a real lack of timely, like near real-time, effective surveillance tools. And with dengue, it's been identified as one of the WHO 2020 dengue objectives is to develop effective surveillance tools. So who builds it and how do you do it? Many different approaches, and our organization has one approach that kind of exemplifies our philosophy. So Break Dengue falls under a startup called the Synergist, and we have several initiatives across different healthcare issues. Basically, we try to act as an incubator for stakeholders to come together and work collaboratively and to maximize results focused on combating social challenges. Now, Break Dengue is an initiative that is right now focused exclusively on bringing out better outcomes for combating dengue fever related to both the science and community collaboration, communication, and awareness. We work with a diverse range of partners, some of which you can see on this slide, and some of them are funding partners, some bring various levels of expertise, some help us to engage with communities in which dengue is endemic. But in every case, we work to make those relationships effective because it can be quite complicated when you have organizations of different size, different priorities, and to keep them focused and effective and have the results be measurable. And in the case of looking at how to enact better surveillance related to dengue, one of the steps we took at the Synergist and with Break Dengue is to develop a tool called Dengue Track, which was the first step in where we're moving towards hopefully an effective surveillance tool for dengue and other vector-borne and AIDS-borne diseases. So looking at Dengue Track, it started out of our approach, which is all about collaboration and looking at communities that oftentimes their voice related to the effect of dengue in the local communities isn't shared broadly, or there's maybe a lack of awareness. And we came about this idea of a scripted chat tool that could help us to geolocalize information about what was happening in communities affected by dengue. And so using the Dengue Track, a person can go to the website. They're invited to answer questions that can help pinpoint activity in their area related to dengue. And then, based upon their responses, if you have a large enough volume, you're then able to place on a map the results and also provide targeted toolkits to the individuals that come to the website. Now, the idea is only as effective as the volume of people you get interacting. And right at this time, we haven't had as effective in a volume that we want in the different geographic locations that we needed in. But it led to a lot of really good learnings about, one, how to collaborate, because we didn't have the expertise for the science behind it on both the technology side as well as in the side of algorithms to take in that data and turn it into something effective. And so we had to reach out and figure out how to make these relationships work and find those who had expertise in the area, which led us to working with Harvard Medical School and Boston Children's Hospital. And as a result of this first stage, we came about the idea that, well, what if you looked at search queries, as our partners at Harvard Medical School did, related to flu trends, and you were able to take not just the information from a scripted text, but actually pull data from social media and from internet searches, and somehow use an algorithm that could correlate that with predicting spread of dengue. Because we've seen this, we've seen the effects of this across dengue and across flu with Google, but they had a really difficult time getting the correlation to match up. So our partners had some effectiveness in improving that model. And so we worked with them to look at search results, and we came up with some pretty decent results. This is an example of where we had, you can see the red predicted based on our search algorithm and the actual results that were verified later, and we see a pretty decent correlation. And so we started talking about how we could make this into something much larger and something that's actually usable by both members of affected communities and by public health agencies and people at the expert level. Our results actually are going to be published tomorrow in PLOS from the research related to internet search, and it's just a building block, but it was something that encouraged us and led us to look at how to build a partnership around building a new surveillance tool that would take in multiple sources of data. So that's the stage we're in now. We're trying to pull in partners that bring in different levels of resources, financial, some of them, some different levels of expertise, and how to manage the project of getting a diverse team to work to build a multi-data source surveillance tool. And the goal will be to capture traditional epidemiological data, search queries, various social media data, perhaps we hope related to vector control and weather data, to have information that can eventually be used along with rapid diagnostics to provide near real-time surveillance of dengue, and then provide two levels of interaction. One for members of communities that can provide information about the situation on the ground, but also take targeted information, provide these toolkits, but more effectively, and then as well have the health authorities and researchers have access at a much more at a much more developed level to the information that we provide, and hopefully make it sustainable so that we can keep running this project and have it improve itself over time with the increase in the volume of information and the more frequent use of the outputs from it. We'd like that to be scalable in the sense that it's agnostic to the type of disease, as long as it's vector-borne, especially AIDS vector-borne, that we believe we'll be able to develop a tool that allows you to implement it in different regions, have it useful to a wide variety of stakeholders, which will increase the value and the efficacy of it, and have it usable in a variety of technology platforms. And as you can see under the channel topic, we're hoping that we can develop an effective way to track vector-borne disease across the inputs, as we are able to increase the number of data sources. So just going back to this, it kind of demonstrates where it looks good on the diagram, but actually managing those relationships and the experience and expertise involved in getting them to come out with concrete results is where we fit in, because we at Break Dengue are not researchers, although we work with them and we bring them together, and we are not experts in the technology. But what we have learned is that by trying to create a win-win situation through shared value partnerships, we can effectively remove barriers that keep many different groups working in silos that are all working towards often short-lived, isolated initiatives that don't receive the support that they could benefit from, because groups that would have a natural alignment with one another don't have the tools to effectively work together. Not necessarily the lack of desire, that's often there, but desire is one thing. It's very complicated to organize the communication across the culture of different sectors, just in academia alone, to manage the outcomes among stakeholders that have very different levels of resources, very different timelines in which they need to produce results. And so in order to make a vision like this effective, we come in and we provide as much as possible a neutral space. We manage the imbalances, and we help drive the strategy towards reaching outcomes. So using this surveillance tool as one example, the fact is the integrated approach, as has been mentioned throughout the day, is just naturally the only solution to combating any of the vector-borne diseases. There's no one solution. And so some of the initiatives that we're working on at Break Dengue are our forum to bring together researchers, academics, and public health officials, and one online forum through our Global Dengue Lab, which is an effort to foster collaboration and communication and a social space. Recently, I returned from Colombia, where we're engaging with ISIC, a youth leadership organization, to set up exchanges between youth leaders in Colombia and Brazil, focused around public health initiatives related to vector control, vaccination, and community education. And this will be our first step into having a presence on the ground in communities in which dengue is endemic. So, Break Dengue in a nutshell, and our efforts to take an approach based on fostering collaboration and bringing down barriers between all of the different initiatives and organizations and groups that are working on the fight against dengue.